Now on to the fourth module, Family and Social Consequences and Needs. What is the impact on the family having a child who's sustained a pediatric traumatic brain injury? Not surprising, there are stresses related to that injury, and there are burdens that come up with the needs of the child at that point. Family difficulties can become more prominent during developmental transition. So if the child sustains injury, for example, in 3rd or 4th grade, there can be increased kinds of stress associated with the child's transition to middle school or to high school or graduating from high school. The nature of the family stress can change with the development of the child. What are the most common needs identified by families of children who sustain traumatic brain injury? Families want more information about the injury, about recovery patterns, and of course, anything that could be said about outcome. And it's particularly frustrating for families when there's limited ability to predict outcome, which is often the case. But they want to know the types of risks that could occur, and most importantly, they want to know what they should look for next in their own child's recovery. Another commonly identified need for families is resources. These can be all types of resources, including after a severe injury, having somebody available to watch the child in certain circumstances. And finally, families request communication with other families who have been through similar traumas. Now, not every family is going to want to talk with another family, but it's not an unusual request. They might say, "I'd really like to talk with someone else who's had a child go through this and who's gone through this as a family." What are the factors that predict long-term family difficulties? Well, socioeconomic status is one, and again, that's the family's level of education and income. If you're more impoverished, you're at a greater risk as a family for difficulties that persist after the injury. How your family was doing before the injury predicts how your family is going to do after the injury. Again, families who were relatively healthy are going to do better in the long run after the injury. How much family stress was there before the injury is another important predictor. Families that had a lot of stress and conflict, or families that lacked support overall, are at greater risk. How the parents cope or what types of coping strategies they use are very important predictors of how they're going to do in the long run. To what extent do they use acceptance in the way they cope with difficulties? To what extent do they use humor? Denial. Now, you'll often hear people say, "Oh, denial is a terrible thing. It'll get you into trouble." It can be protective to have some denial of the severity of events at certain points during the child's recovery, as long as you're taking the steps that you need to get things done the way they need to get done. Get the resources you need, that kind of thing. But overall, if your general tendency is to cope with denial, then you're more likely to have difficulty after an injury. There are reciprocal relations between how the family does and how the child does. The family's difficulties and the child's difficulties each influence each other. If after the injury the family is struggling, the child picks up on that and they have more difficulty. If the child is having a very difficult time, that's stressful for the family and they're going to have greater difficulty. So it's a reciprocal relation. Regarding family interventions, the family with greater resources and lower general stress and healthy coping habits or strategies may require limited intervention, and that intervention can consist of certain types of information that they need. For example, how to get school services and anticipatory guidance. What should you do as your child gets to the point where they need to take driver's education? But families that are at risk, who have less resources and may have had difficulties before the injury, are going to need a combination of interventions. They need information. They may need very specific resources, such as help getting their child to different kinds of medical appointments. They may need particular types of psychological support. And they may need intensive skill-building intervention, including parenting. The needs of families are going to change over time. The nature of the interventions are also going to change over time. Education alone is not sufficient to reduce family stress. You can't simply give people information when they are experiencing a lot of stress after this type of trauma. There are specific stress management programs that have been shown to reduce parent anxiety and depression, and that can be a good recommendation for particular families. There are also specific types of interventions that will affect parenting and then have good effects on the child's progress. For example, the family problem-solving intervention, which has been studied by Dr. Wade's group, has been shown to decrease depression in children with mild or more recent injuries and tends to be more effective when the child is a little bit older. And this intervention tends to be less effective when the injury is less recent or more severe and the child is younger. Well, what about other types of effects on the child's social behavior and peer relations? After pediatric traumatic brain injury, the child is at risk for lower social competence and for feelings of loneliness. Those social difficulties can stem from a lot of specific impairments. Children can have difficulty understanding emotional states. They can have difficulty understanding others' reactions and states of mind. And they can have very specific problems with social problem solving. So they can have trouble figuring out what to do in certain situations and how to be assertive. For example, if there are some children playing a game, maybe in a classroom, and the child wants to get in on that game, they can have difficulty figuring out how they can get into an ongoing type of activity. And it can be very helpful for them to have instruction in how to be assertive, to be able to ask to do the things when the timing is right. Social outcomes tend to be worse in families that are lower functioning and have fewer resources. Again, the same thing we've been talking about repeatedly. There are social skills interventions. There are specific interventions for deficits in understanding other people's emotions and states of mind that can be affected. There are promising school-based interventions for social skills, but what I want to emphasize is the next 2 points. If you do a social skills intervention with a child without having a generalization strategy, it will not be effective. Generalization strategies are ways of cueing the child to practice and use new skills in different settings. So if there's an intervention and the child is learning how to make certain kinds of assertive statements, how are they going to practice that in real settings rather than just simply in some sort of social skills group? There must be maintenance strategies so that the skills they're learning continue to be reinforced over time because they can fade out. So many of the areas that we've talked about, cognitive, psychological difficulties, social kinds of concerns, can be identified in a neuropsychological evaluation. And I just want to touch on some of the ways of thinking about if and when to refer these types of assessments. In general, it's not necessary to refer for a neuropsychological evaluation after a mild injury that had no focal neurological findings and no evidence of change in cognition or personality. So you don't want to just automatically refer for these big assessments to identify problems if there are no problems seen. You do refer for neuropsychological screening or full evaluation if there are focal neurological findings and if there are persisting problems with attention, processing, speed, memory, or academic difficulties. Screening evaluations will typically occur within 2 weeks after an injury. Full evaluations typically will not occur until about a month after an injury because children change very rapidly in the first month. So, just to summarize, we've talked about, in general, the incidence and prevalence of pediatric traumatic brain injury. We've talked about the nature of injury, primary and secondary effects. We've talked about key predictors of outcome, including how the child was doing before they were injured and how the family has been functioning, and then specific medical kinds of indicators. Then we discussed very specifically some cognitive impairments and academic needs, as well as psychological and psychiatric types of risk. Finally, we discussed the family's needs and some of the child's social risks.